Welcome to Ulosca channel. Access all nursing practice questions. Cardiovascular and respiratory practice questions with answers.
Question 1. A nurse is caring for a patient with atrial fibrillation. Which medication is commonly prescribed to prevent stroke? A. Furosemide. B. Warfarin. C. Amoxicillin. D. Ibuprofen. Which one is the correct answer? The correct answer is B. Warfarin. Explanation. Patients with atrial fibrillation are at risk for blood clots due to irregular heart rhythms. Anticoagulants help prevent stroke by reducing clot formation. Question 2. Which clinical sign suggests right-sided heart failure? A. Crackles in lungs. B. Jugular vein distension. C. Orthopnea. D. Pink frothy sputum. Which one is the correct answer? The correct answer is B. Jugular vein distension. Explanation. Right-sided heart failure causes blood to back up into the systemic circulation, leading to symptoms like jugular vein distension and peripheral edema, unlike left-sided failure, which affects the lungs. Question 3. A patient with chronic heart failure gains 3 kilograms in 2 days. What is the nurse's first action? A. Restrict activity. B. Increase protein intake. C. Notify the healthcare provider. D. Encourage more fluids. Which one is the correct answer? The correct answer is C. Notify the healthcare provider. Explanation. Rapid weight gain in heart failure often reflects fluid retention, which can worsen heart function and lead to pulmonary edema, requiring immediate medical review. Question 4. Which assessment finding requires immediate attention in a patient with COPD? A. Barrel-shaped chest. B. Clubbing of fingers. C. Use of accessory muscles. D. Confusion and drowsiness. Which one is the correct answer? The correct answer is D. Confusion and drowsiness. Explanation. Confusion and drowsiness in COPD patients indicate worsening oxygenation or carbon dioxide retention, which could lead to respiratory failure if not treated quickly. Question 5. Which of the following medications is a beta blocker used in managing hypertension and angina? A. Metoprolol. B. Lisinopril. C. Furosemide. D. Digoxin. Which one is the correct answer? The correct answer is A. Metoprolol. Explanation. Beta blockers like metoprolol reduce heart rate and myocardial oxygen demand, making them effective for controlling high blood pressure and preventing chest pain and angina. Question 6. Which finding is most concerning in a patient post-cardiac surgery? A. Pain at the incision site. B. Low-grade fever. C. Increased chest tube drainage greater than 200 milliliters HR. D. Fatigue. Which one is the correct answer? The correct answer is C. Increased chest tube drainage greater than 200 milliliters HR. Explanation. Excessive chest tube drainage is a sign of possible postoperative bleeding or complication and should be addressed urgently to prevent shock or cardiac tamponade. Question 7. Which oxygen delivery method provides the most precise oxygen concentration? A. Nasal cannula. B. Simple face mask. C. Venturi mask. D. Non-rebreather mask. Which one is the correct answer? The correct answer is C. Venturi mask. Explanation. The Venturi mask delivers a controlled and precise concentration of oxygen, which is particularly important for patients like those with COPD who need exact oxygen levels to avoid CO2 retention. Question 8. A patient with pneumonia reports pleuritic chest pain and dyspnea. What is a priority nursing action? A. Obtain a sputum culture. B. Encourage deep breathing. C. Administer prescribed analgesics. D. Elevate head of bed and apply oxygen. Which one is the correct answer? The correct answer is D. Elevate head of bed and apply oxygen. Explanation. Elevating the head of the bed improves lung expansion and oxygen delivery, which are critical for patients experiencing dyspnea and hypoxia for pneumonia. Question 9. A patient complains of chest pain unrelieved by rest and nitroglycerin. Which condition is suspected? A. Stable angina. B. Unstable angina. C. Gastroesophageal reflux. D. Costochondritis. Which one is the correct answer? The correct answer is B. Unstable angina. Explanation. Unstable angina presents with chest pain that occurs unpredictably and does not improve with rest or nitroglycerin, signaling a higher risk of heart attack and requiring urgent care. Question 10. Which dietary choice should the nurse recommend to a patient with hypertension? A. Canned soup and salted crackers. B. Fresh fruits and steamed vegetables. C. Bacon and scrambled eggs. D. Fried chicken and mashed potatoes. Which one is the correct answer? The correct answer is B. Fresh fruits and steamed vegetables. Explanation. A heart-healthy diet like DASH encourages fresh produce and low sodium intake to help reduce blood pressure and improve cardiovascular health.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.